Hi everybody, I'm Stephanie Haney here. It is Friday, May 22nd. I'm here with your 3 News Now afternoon update. We've got the top headlines for you from WKYC.com and our WKYC app. Remember, with the holiday weekend upon us, Governor Mike DeWine is not doing a press conference today, but we do have the most up-to-date numbers in from the Ohio Department of Health, and I'll share those with you now. Some good news, some relative good news. The numbers across the board for new daily reported cases, new daily reported deaths, new daily reported hospitalizations, and intensive care unit admissions are all down from yesterday. So we'll dive into breaking those numbers down, as well as the numbers across the country and across the globe. So first up, the total number of cases now in the state of Ohio is 30,794, both confirmed and probable cases of COVID-19 in the state of Ohio. So the number of new cases reported today is 627. That's down from yesterday, but do remember this. Yesterday, there was a big spike in the number of new cases. So to be down from yesterday, while it's important to note that we are down from yesterday, in terms of the numbers this week, aside from yesterday, this is still the highest number of new cases in the past week. The other numbers of new cases we saw this week were 484, 498. The other highest number, except for today, was 597. That was last Friday. So for us to have 627 new cases today, reported today, that is down from yesterday, but that's still a relatively high number for the week. In terms of the number of deaths now reported related to COVID-19, the total number is 1,872 here in the state of Ohio. That is also down in terms of new deaths reported from yesterday. So today there have been 36 new deaths reported. Now that's down significantly from yesterday when we saw 55 new deaths reported. On Wednesday we saw 61 new deaths reported. On Tuesday we saw 63 new deaths reported. Monday was a much lower number. We saw 32 new deaths reported, so we're back in that range now. Again, with the total number in Ohio being 1,872. In terms of the number of total hospitalizations, this is since we first learned of COVID-19 being here in the state of Ohio, dating all the way back to March 9th. That number is now 5,379. The number of new hospitalizations reported today is also down from yesterday. There were 84 new hospitalizations reported today, and a total of 879 people who are actively hospitalized at this moment. And that's also down from yesterday, both of those numbers. In terms of ICU admissions, the total number dating back to March 9th is 1,416 people who have been admitted to the intensive care unit with COVID-19. And the new number today reported admitted is 19, which is also down from yesterday. Yesterday, there were 28 new ICU admissions reported. And the number of active ICU admissions, however, this is the one place where we are up. 362 active ICU admissions right now. Yesterday, there were 349 active ICU admissions. So people who are in the ICU right now at this moment, according to the Ohio Department of Health. Let's take a look at the numbers across the country and across the globe just to see how we compare there. In the U.S., new cases reported today are up slightly and new deaths are down slightly. This is according to Johns Hopkins University. That's where we get those numbers. So there were 25,608 new cases reported in the U.S. of COVID-19 today. So that's up slightly from yesterday when there were 25,130 new cases reported in the U.S. The total number of cases now in the U.S. is 1,588,000, roughly. The total number of new deaths reported today in the U.S. is 1,413. That brings the total number of deaths in the U.S. now to 95,276. Now remember, there was a lot of talk early on about the projections and the total number of deaths that we would see related to COVID-19. Every single day this week, we have seen more than 1,000 deaths, sometimes many more than 1,000 deaths. On Tuesday, we saw 4,200 new reported deaths. So just keep that in mind. I know when we talk about these numbers, it can be pretty abstract, but there still are a large number of people around the U.S. who are losing their lives related to COVID-19. And at this rate, if we continue at this rate by the end of June, we will have over that 120,000 mark, which was the lower estimate of what we expected to see, what was projected that we see in terms of numbers of total deaths related to COVID-19. So just keep that in mind as we're thinking about the people who are still suffering with this and who are fighting it and hoping to recover. The U.S. has about 23% of the new cases reported worldwide today, and 25% of the new deaths reported worldwide today. So we'll take a look at those worldwide numbers right now. Worldwide, both new cases and deaths reported today are up. There have been a total of 112,297 new COVID-19 cases worldwide reported today, bringing that total to about 5,160,000 reported cases of COVID-19 across the globe. In terms of new deaths, there were 5,602 worldwide new deaths reported today, bringing that death toll that we know of, that we are aware of, that's been reported by Johns Hopkins University to 335,418 people around the globe. Let's talk a little bit about the malaria drug that's been talked about by President Donald Trump. There is a new study that now casts even more doubt on the use of this malaria drug. So it's been pushed by President Donald Trump as a treatment for the coronavirus, but in this new study, it did not help and was in fact tied to greater risk of death and heart rhythm problems. And this is a study of nearly 100,000 patients around the world. This was published in the journal Lancet, and it's not necessarily a rigorous test of hydroxychloroquine or chloroquine, but it is by far the largest look at their use in real-world settings. So nearly 100,000 patients around the world, spanning 671 hospitals on 6 different continents, and these are the results they came to. Dr. Mandeep Mehra, a heart specialist at Brigham and Women's Hospital in Boston, said that not only is there no benefit, but he saw a very consistent signal of harm with the use of the hydroxychloroquine and the chloroquine in this study. Researchers estimate that the death rate attributable to the use of the drugs with or without an antibiotic is about 13% versus 9% for patients who are not taking them. And the risk of developing a serious heart rhythm problem is more than 5 times greater for patients who are taking the drugs versus patients who are not taking them. Now, the drugs are approved for treating things like lupus and rheumatoid arthritis and for preventing and treating malaria, but no large tests have found them to be safe and effective for preventing or treating COVID-19, despite Trump announcing to reporters that he is actually taking it. Now, you might be seeing some information floating around social media about Trump having a financial stake in hydroxy. I'm having a hard time saying it right now, but hydroxychloroquine, him having a financial stake in that. And the truth is that he does, but it's a very small stake, and this is according to PolitiFact, a reputable fact-checking resource website. So Trump does have a small stake through a mutual fund in Sanofi, which is a French company that makes hydroxychloroquine. There, I knew I was going to say it right for you this time. So his holdings in Sanofi are valued at about $1,500. So that means he would not profit much from the company's stock performance if there was a huge run on the use of hydroxychloroquine. And experts do say that his holdings are not in violation of any federal conflict of interest laws. So if you do see that floating around social media, you can know that, yes, it is technically accurate, but it's such a small stake that it is effectively inconsequential in terms of the continued conversation about Trump choosing to take hydroxychloroquine without the recommendation of a doctor, though the White House physician has said that he discussed it with Trump and they did consider all the factors and that it would be less harmful than potentially beneficial in Trump's case. That's what the White House doctor said. As we look to more things reopening here, Lieutenant Governor John Husted reminded people yesterday in the press conference that BMV business can be done online as those locations prepare to reopen next Tuesday, May 26th. And let's be honest, I don't think anybody's necessarily really excited to get to the BMV, right? Well, you don't have to rush out there, and you probably, in most cases, don't even actually have to actually physically go. Most things can be done online at bmv.ohio.gov, and that's what's being recommended by officials. Here's just a small sampling of some of the things you can do online at bmv.ohio.gov. You can renew, replace, and exchange your vehicle license plates. You can pay reinstatement fees if your license has been suspended and you need to reinstate it. You can schedule a driving test if that's something that you need to do. You can change your address. You can file next of kin emergency contact information. And if you're in the military, you and your dependents can renew your driver's license or request a duplicate ID card. Now, for the rest of us, if your driver's license has expired during this period when BMV locations have been closed, there is a law that has been passed. So all expired licenses will remain valid until either 90 days after the current state of emergency ends or December 1st, whichever comes first. So if we are still in a state of emergency at December 1st, your license will expire if it's expired. If we are ending the state of emergency before December 1st, then your license will truly expire 90 days after the end of the state of emergency. And if you do absolutely positively find that you have to go to the BMV, it's recommended that you use the website's Get In Line online tool so that you can get in line and have an idea of when you'll be serviced, so that people aren't just showing up there and crowding the BMVs, because that is exactly what we do not want as we continue to stop the spread of COVID-19 by practicing safe physical distancing. Something else that will be reopening soon are Ohio's catering centers and banquet halls. Those, as of now, are able to reopen on June 1st. That was announced yesterday in the press conference. And they'll be subject to similar safety restrictions like restaurants. Tables will need to be at least 6 feet apart. Congregating will not be allowed, and employees will be required to wear masks, as well as those other restrictions subject to restaurants. And for the time being, these banquet and event halls will be limited to crowds of 300 or fewer. You can read more about that on WKYC.com. Here's something special we want to share with you. There's something new coming to Lakewood. It's called the LAKEWOOD Truck Park, and our food editor, Doug TRATTNER, check it out. He got a first look at it. So this is a project that's being put together by Dan Deegan, who has had 10 years of success at Deegan's Kitchen in Lakewood, and then also 7 years with the nearby Humble Wine Bar, also in Lakewood. So he's teamed up with Justin Costanzo to create the LAKEWOOD Truck Park. So what this is there's an indoor space, that's the bar area, and then there's an outdoor space of a patio where food trucks can pull up. And those food trucks aren't owned by Deegan and Costanzo. Those are just the regular food trucks that you've seen at many events around Cleveland, parked in the street. But those events, unfortunately, have been canceled, so those food trucks haven't had a place to go. Well, this is expected to open next week. So there is a 4,000 square foot indoor space. They've got bars, TVs, and restrooms indoors, and then it's connected to a massive patio with garage doors where there are picnic tables, alfresco bars, Adirondack chairs, fire pits, cornhole boxes are out there too. Not sure if you'll be able to actually play the cornhole. I'm not sure what the rules and regulations are on that because of the tossing of the bean bags, but I'm sure they'll probably have sanitation procedures in place if those are available for playing at this time. So this is something that Deegan has been working on for 5 years, and he's excited to finally bring it to fruition. That patio space is 9,000 square feet, so he definitely did not envision opening this space during a pandemic, but it might be uniquely situated to be a place that he thinks he can provide people the ability to be safely physically distant and also enjoy outdoor activities and food trucks and drinks in an enclosed space. And he also jokes about the fact that, yes, this is an outdoor space. Yes, this is Cleveland. We do get some kind of unpredictable weather sometimes. But he says it'll be fine because if you've seen the Muni lot on a Sunday in the winter, people are still willing to go outside. And Clevelanders will go outside in shorts when it's 50 degrees outside, he says. So that LAKEWOOD Truck Park is expected to be ready to go this week, but he's just waiting on final okay from officials, which he's expecting within 2 weeks. So if you want to check that out, keep an eye on that. Of course, we'll let you know when that's open on WKYC.com and our WKYC app. This has been your 3 News Now afternoon update for Friday, May 22nd. Next up, I'll see you at 5 p.m. on What's New. That's on the air on Channel 3, but also on WKYC.com, our WKYC app, and on YouTube at youtube.com/user/WKYCTV if you'd like to stream that live with us. We'll also have continuing coverage for you on What Matters Most at 6 p.m., on Front Row at 7 p.m., and What's Next at 11 p.m. And that'll do it for me here for this week. I will see you back here on Monday, on Memorial Day at 11 a.m., early in the morning. All right, I will see you then, everyone. Have a great weekend. I'm Stephanie Haney.